What we're hearing from the places that are reporting these cases are that there are some children, usually previously healthy kids without underlying medical conditions, who have been admitted to hospital with severe hepatitis or severe inflammation of their liver. Hepatitis is just a term that refers to inflammation of the liver. And so there can be many different causes. In kids, probably the most common causes are infections, usually viral infections, but it can also be caused by certain medications, certain immune system issues like autoimmune hepatitis, for example, or exposure to certain toxins. So the symptoms of hepatitis relate to the liver not being able to do its job properly. And so some of the symptoms that you might notice is yellowing of the skin or the whites of the eyes. Sometimes the whites of the eyes is where it shows up first because it's easier to pick up than in the skin. Kids may complain of abdominal pain, so especially in the right upper part of the abdomen, which is where the liver sits. They may have pain specifically there, but it can be anywhere in the abdomen. You might notice dark urine or light-colored stool. When they've looked for kind of the typical viruses that we think of that cause hepatitis in children, they haven't found those usual viruses. But what many of these children have tested positive for is a virus called adenovirus, and a specific type of adenovirus called adenovirus 41. Adenoviruses are a large group of viruses. I think there's about 50 different types that we know of. And they can typically cause certain illnesses, for example, pink eye, vomiting and diarrhea, so stomach flu type illness, or respiratory illness with runny nose and cough. These circulate pretty commonly amongst children. We think this is unlikely to be related to COVID-19, but it is one of the things that we need to really look at and study to make sure that we've explored all of the possible relationships. Another question that has come up is whether this could be related to COVID-19 vaccine. As we don't have a vaccine that is approved for use in kids under 5 years of age, many of the children that have been reported with this have not been vaccinated. So there's no evidence to suggest this could be related to a vaccine.